Hi fam. I want to come on here and provide a quick update and let you know how the last cycle went. That was cycle 8. We had another little port issue. Everything went fine in the infusion clinic. But however, at some point my infusion, my 5FU balls stopped infusing, and I didn't really notice it until Friday night going into Saturday. So I talked to the doctor on call, and he said try not to worry about it. It probably didn't affect much, that the cycle could be possibly made up. And I talked to my doctor's nurse on Monday, and she said that, Dr. Shukla really didn't want to do that since he didn't know how much I got. And I know I didn't get half of the infusion. So I went in for a port flush on yesterday and everything was fine. They got blood returned. So if that wouldn't have went that way, they would have done some kind of port study, I guess, and injected some dye in the port, but that didn't have to happen. I think when she went to put the needle in, she was kind of off to the side a little bit because another nurse had to come in and navigate it. And at some point it just must have shifted again. And I don't know. I tell you, this whole thing is just, it can be kind of, I guess it's uncommon to have 2 port issues, but I have had 2 port issues. This thing is kind of, taxing. It seems like it's, it's just, I'm sure every cancer patient feels this way. It can be mentally taxing, as well as emotionally, mentally, emotionally taxing, physically taxing, a lot to process. So I definitely, it's definitely, a journey I have not experienced. So I do tend to have a little bit of anxiety, more anxiety than I think that I have had in the past. I'm trying to give myself some grace because I think this is just, a lot. Social worker had called to kind of check up on me on Monday, and she kind of made a comment when I was talking about, my chemo and what I have to pay for out of pocket and everything. And she had said, well, have you considered maybe going on disability? It would be about 60% of your wages, but then, the insurance would be different, and we could get emergency insurance and it would pay for it or whatever. And I don't know, I thought about all kinds of scenarios, but that particular scenario I had not thought of. And honestly, it just, made me get a little anxious. And because 60% of my wages, that's a lot. I mean, and I'm not necessarily prepared for that. I had thought about some other things I was prepared for, but that particular one, I guess that thought had not crossed my mind. So I've been trying to do better. I know that my job, I can continue to work through home with special accommodations through the rest of the year, so that's not really an issue. But working from home, it's good. And I used to work from home for a few years, about 4 or 5 years, but it can be kind of isolating, working from home, and just, so a good friend of mine, I talked to a good friend of mine, she told me that I should just definitely keep my mind busy. So I'm going to try to keep my mind busy and have positive thoughts and not think so hard about the future. Just try to get through this, and take each day as it comes. Of course, we need to plan for the unexpected, or at least have an idea of what we might do. And I'm working on that. So, but overall, I feel better today. I finished binge watching my Reacher show that I was watching on Netflix, so I'm on the hunt for a good show. If you have any ideas of anything good on Netflix that you've enjoyed, or even Amazon Prime, certainly let me know. Leave it in a comment, and I will definitely be looking for something else to watch, because that's kind of what I do on the weekends I have chemo, is I just kind of stay at home and binge watch TV. Of course, this weekend I'll probably be, out and about doing some things, getting ready, going to the store, things like that. So, feel free to leave me a comment, or, let me know what you've been doing to keep yourself busy when you feel, you feel a little stuck in the house and you don't know what to do with yourself. If you have any ideas of any distractions, certainly I am open. open to some words of wisdom. So I just wanted to come on here and let y'all know how I'm doing. My doctor did adjust my Creon dose. That's the enzyme that I take that helps me, you know, since part of my pancreas is not producing some of the digestive enzymes. She did increase that. And hopefully I can stop losing about 1.5 pounds every time I go in there. Or no, 1.5 pounds. That's what I've been losing. So I'm just trying to be as healthy as I possibly can going into the upcoming surgery. And so fingers crossed that this at least helps me just maintain, you know, my weight. I think I'd feel a little bit better about it if I could just maintain it and not lose 1.5 pounds. So otherwise, I'm hanging in there, certainly. Just wanted to let you guys know what was going on. And I love you all with all my heart. And I hope you have a good day. Bye for now.